conference will now be recorded.
Okay na? Right. ఇది స్టూడెంట్స్ ఇది జస్ట్ ఇది ఎక్స్ప్లెయిన్ చేయలేదు కదా? ఓకే ఓకే రైట్ సరే రైట్ just 1 minute. Yes, Chipama. So, mechanism of sulfonamides, because it is also very important. Recollect previous class, very important, so that we can remember it for long period. So, mechanism of sulfonamides.
Sulfonamides prevent the folic acid synthesis.
Good.
Hello.
Right. So, folic acid
inhibit
synthesis inhibition.
And it inhibits it inhibits the action of PABA inhibitors.
PABA. That means para-aminophenolic acid.
Yes.
Okay. What is sequential blockade? What is sequential blockade, Amma?
Sir?
What is sequential blockade? Sequential blockade.
Sorry, I didn't read it.
You didn't read, so class lo వచ్చింది మీకు అది చెప్పేటప్పుడే మీరు నోట్ చేసుకోవాలి ఇంపార్టెంట్ పాయింట్ సీక్వెన్షియల్ బ్లాకేడ్ వెరీ ఇంపార్టెంట్ సో ఓకేనా రైట్ okay anyway so today's class is quinolones. So this is structure of quinolones. So by modifying its structure you can get new products and they will have different type of actions, type of actions. So one group of antibiotics తీసుకుంటే they will have some distinct mechanism of action. So each group is having their own type of mechanism of action. Finally they will inhibit both of my agents. What happened? This slow network connection. Okay, so now you see this is the you come to this one chemistry structure of fluoroquinolones. Quinolones contains the carboxylic acid moiety at position 3 of the primary ring structure, and the fluoroquinone contains fluorine substitute. So in the Japan structure activity relationship SAR, it's called as SAR, structure activity relationship. So by modifying the structure by means of addition or deletion of some sort of moieties, they give new products. So like that here also quinolones. So you can get the new products, that is fluoroquinolones, by addition of fluorine moiety as substitute of 6th and the piperazine moiety at position 6, position 7 of structure of quinolones. Okay, so they give new sort of okay, they exhibit some sort of new pharmacological actions. Okay, now so now we see this is so quinolones. They are referred to as fluoroquinolones, are a family of synthetic broad spectrum antibiotics. They refer to as synthetic broad spectrum antibiotics. But the broad spectrum antibiotics for broad spectrum antibiotics low, there is tetracyclines as well as chloramphenicol. So here we are naming the so-called fluoroquinolones synthetic broad spectrum antibiotics. Okay, So one more thing is the term quinolones refers to potent synthetic chemotherapeutic antibacterial active. Okay, and there are so many generations: first generation, second generation, third generation, fourth generation, like that. They're classified. So the first generation of which was derived from an attempt to create a synthetic form of chloroquine in 1934. So accidentally they found that various experiments on chloroquine in 1934. Uh, they accidentally they found that they have new products, that is fluoroquinolones. So first generation of the quinolones begins with the introduction of naldixic acid. Naldixic acid in 1962 for treatment of UTI, urinary tract infections, and this was discovered during an attempt at chloroquine synthesis. So by various experiments on other group of drugs, they came to know that new product formation and new kinetic actions and dynamic actions. Okay, so this is first quinolone is naldixic acid. By modifying its structure, you will get new products. Uh, Next one, so how they will act? How they will act? Mechanism action. So in the manu penicillin తీసుకుంటే penicillin inhibiting cell wall synthesis, అట్లాగే sulfonides they act by inhibiting the they interfere they compete to the compete things are there. అట్లాగే మనకి subtly block the GABA. So like that. So there are so many things. Sulfonides, um, cephalosporins, macrolides, macrolide antibiotics, tetracyclines, like here fluoroquinolones. So they inhibit by synthesis of ribosomes. So they act at the ribosomes. 30 years, 50, 70, like that. They will have. So finally, protein synthesis is inhibited. So here, these are also having their own style of mechanism of action, and here they prevent the bacterial DNA from unwinding and duplicating. So here, unwinding and duplicating for DNA is important for formation of new products. So new, the cells, new cells. So here, the steps where become target is important for unwinding plus duplication of DNA, DNA of microbial agent. So the DNA guidase enzyme will be inhibited by these drugs, so that the unwinding as a duplication of the cell will be inhibited. One more in addition to that, the topoisomerase and target for variety of various quinolones. So topoisomerase 2 as well as DNA gyrase. So that's what they comes under DNA gyrase inhibitors. So they act by DNA gyrase inhibition. They call it DNA gyrase inhibitors. So that is nothing but fluoroquinolones. Fluoroquinolones. In addition to that, topoisomerase 2 is also will be inhibited. Okay. So, and the parent of quinolone class is naldixic. The first drug that is discovered. So in this group is naldixic acid. So majority of quinolones in clinical use belong to the subset of fluoroquinolones, which have a fluorine atom attached to central ring system, typically at the 6th position or C7 position. So in the structure actually, now we come to the naldixic briefly. So naldixic acid is considered within the president of all acid quinolone family, including second, third, commonly known as fluoroquinolones. Okay, so that's what first, fourth generation. The drug of fluoroquinolones is naldixic acid. Second generation, various generations. Okay, so the first generation included other quinolones such as so pipimidic acid and oxalic acid and cyanoxacin, which are introduced in 1970s. They proved to be only over the naldixic acid. Okay, anyway, but in contrast to in action, it's still improvement. So they will have some differences in between the drugs of the same group. Okay, so and since there has to be two analogs have been synthesized, but only a handful have found their way into clinical practice. Okay, the fluoroquinolone drugs are most toxic and dangerous antibiotics in clinical practice today. Okay, should remember because they will have broad spectrum, of course, the broad spectrum, but they will also have some toxic effects. Okay, so here now we see various generations of fluoroquinolones. First generation, second generation, okay, third generation, like that, fourth generation, like that. So what are the first generation? Ciprofloxacin. In the 1970s low, they found the drugs from nalic acid. So this is ciprofloxacin, nalic acid, oxalic acid, gluminic acid, pipimidic acid, roxacin. So these comes under first generation fluoroquinolones. First generation fluoroquinolones. Okay. Next one, second generation. Come to the second generation. One is ciprofloxacin, enoxacin, fluoroxacin, lomifloxacin. Even try to note down. Try to note down under nodifloxacin, norfloxacin. సో ఓఫ్లాక్సాసిన్, ఫ్లాక్సాసిన్, రఫ్లాక్సాసిన్. సో ఇవన్నీ మనం ఆల్రెడీ కొన్ని పేర్లు వినుంటాం ప్రీవియస్, బట్ ఎక్కడ ఏది వస్తుందనేది మనకి ఇంకా క్లారిటీ రావాలంటే మనం చాప్టర్ చదవాల్సిందే. సో సిప్రోఫ్లాక్సాసిన్, ఎనాక్సాసిన్, పెఫ్లాక్సాసిన్. ఓకే, ఎస్ రాస్తున్నారమ్మా, నోట్స్ రాసుకుంటున్నారా? ఎస్. ఏం మిస్టర్ 92 రాస్తున్నావా? 92 92.
Yes, sir. Yes, sir.
Okay, nice. Carry on. Okay. Next, third, let's go for third generation of fluoroquinolones. Third generation, yes. So this is unlike the first and second generation. Third generation is active against streptococci. So in that they will have some sort of different potency as well as their side effects as well as kinetic profile. So though they comes under same group of because of their new structure, they have some additional benefits as well as low doses. So they will become finally the మనకు కావాల్సిందంటే ideal drug కావాలి, ideal drug. So with small dose, in addition to that, you can see less side effects, and long duration, and the tolerability. Tolerability is also important. Okay, right. సో థర్డ్ జనరేషన్ వచ్చేసి మనకి బ్యాలోఫ్లాక్సాసిన్, గాటిఫ్లాక్సాసిన్. జనరల్ గా న్యూవర్ ఫ్లోరోక్వినోలోన్స్ లో గాటిఫ్లాక్సాసిన్ ఉండేది. సో గ్రెపాఫ్లాక్సాసిన్ అండ్ మాక్సిఫ్లాక్సాసిన్, మాక్సిఫ్లాక్సాసిన్, పాజుఫ్లాక్సాసిన్, స్పార్ఫ్లాక్సాసిన్, టెమోఫ్లాక్సాసిన్. ఓకే, సో all these drugs we should know well. సో పేర్లు ఇవన్నీ గుర్తుండాలి మనకి, తప్పదు. సో నెక్స్ట్ వన్ ఈస్ ఫోర్త్ జనరేషన్. ఓకే, జెమిఫ్లాక్సాసిన్, సిటాఫ్లాక్సాసిన్, ట్రోవాఫ్లాక్సాసిన్, ట్రూలిఫ్లాక్సాసిన్ అండ్ క్లినాఫ్లాక్సాసిన్. సో జెమిఫ్లాక్సాసిన్, సిటాఫ్లాక్సాసిన్, ట్రోవాఫ్లాక్సాసిన్, ట్రూలిఫ్లాక్సాసిన్, and the development geranoxacin and delafloxacin. Okay, so like this, their drug classification by means of generations. Okay, so now let's go for other information regarding disease. So here chloroquine. So in 1930s, so they found that so nalic acid, Fluoroquinolones acid by various studies on chloroquine. By structure modification, they found that one new product, that is nalic acid, is having some action at the urinary tract infections. Okay. Next for nalic acid to fluoroquinolones. Okay. So this is the structure. So introduction introduce a piperazine moiety and this structure. So they will form new products. Next one is, so one more thing is oxalic acid. Nalic acid gives rise oxalic acid by modifying its structure. So next one is, so nalic acid, norfloxacin. So newer products. So like that. So this is for మనకి గుర్తుంటానికి పెట్టాను ఈ slides. So from norfloxacin to other first generation fluoroquinolones like that. So interconverting. So by adding with methyl moiety, so to increase their half life. So that is kinetic profile. So by impacting their kinetic profile. Okay. So this is the thing. Next slide is, so by duration 1960s to 1980s. So they found that various newer fluoroquinolones. Okay, still the research will going on, and they will produce new products which act against various microbial agents. Next one, of course, so ఇక్కడ మనకి chemotherapeutic action. So how they improve the chemotherapeutic usefulness of first generation fluoroquinolones. So they maintain broad gram negative activity and improve gram positive activity. So this the second generation, and acquire activity against the anaerobic agents. So mainly third generation. Okay. So here next is, this is one more thing is, so okay, need not worry about it. So now we come to this one. So basic structure. So everything is in this single slide. So congeners at the level of R1, R6, R7. So by modifying the structure. So these are the various uh, the fluoroquinolones. Now they need to make an action with the DNA carries so plus 2. So and whereas for example, whereas for many gram positive bacteria, 2.4 is the target of the drug. So when it is gram positive, 2.4 is the target of the fluoroquinolones. Okay. While for many gram bacteria, positive bacteria, so gram DNA whereas is and enzyme is target. Okay. DNA gyration. Why the here is action? You should inhibit the DNA gyration. Is important for multiplication of various microorganisms. So here the stands of double stranded helical DNA. So separation. It's a normal process of DNA synthesis and formation, etc. DNA gyrase must and should in case of DNA gram negative bacteria. Okay. So here double stranded DNA. So helical DNA is called helical DNA. So it should separate, and replication will takes place. DNA replication, transcription will takes place. This is normal process. Whereas in case of in absence of this one, so overbinding or excessive and action will take place in case of DNA gyrase inhibition. Okay. So that's what the next. So next one is, so here is introduce continuous negative superoxidase is energy dependent, that is ATP dependent reaction. So here this DNA kinase enzyme binds to two segment DNA and cause a break in the double stranded DNA and passes the front segment towards uh, it gives some sort of nick, so that intercrossing of the strands will take place. standing up stands will take place, and thereby resealing of that nick takes place, and creation of some sort of coils. So that's called as negative supercoiling. Negative supercoiling. Okay, so that's what that gives rise newer offsprings. Newer offsprings. So it looking like some sort of uh, to understand, but whereas DNA gyrase enzyme is important transcription of mobile agent. So here quinolones inhibit the gyrase enzyme. So by means of nicking is important for overcrossing. I mean crossover segments will form new segments, so that the newer helical brands will form. So that's what whenever you are using quinolones, that the process will be inhibited. Okay. So here DNA arrays of myogens. So A subunit carry stand, and quinolones act at A subunit. Okay. So the stand will come into two parts, so that inner stand will come upward and upper stand comes inward while it takes place. So the at stand subunit A by acting at subunit A. Okay. Next one, the mutations of these genes encode A subunit that leads to resistance. So resistance and the drug resistance is a big topic. So for that there are so many um, contributing factors. Mutations, gene mutation is one. Next one, tobacco 4. So here tobacco 4 uh, gram positive అనుకున్నా gram positive that operates in the bacteria. So tobacco 4 separates the interlinked dotted DNA molecules that are the product of DNA replication. DNA replication. Okay. Next one, the eukaryote cells contain type 2 DNA proteoformase instead of DNA gyrase to prevent positive supercoiling during replication, and anti-neoplastic act at this enzyme. So anti-neo, I mean anti-cancer drugs act at this level. Okay. So this is next one is now this kinetic profile, kinetic actions, absorption, distribution, and elimination. So they're orally they're well absorbed, so that you can take orally. You can see the elevated levels to other routes of administration other than oral route. So and the advantage is oral absorption almost gives rise the plasma levels of IV route. Okay. So distribution is very throughout the body. So all tissue compartments will distribute, and peak plasma levels. Generally, the common features of various types, all groups, all generations. So 1 to 3 hours. So interactions వచ్చేసరికి మనకి during absorption various heavy metals. So antacids or other heavy metals, they may interfere. They may interfere their absorption, like calcium. Calcium have their bioavailability. Okay. So after distribution, they concentrate in various parts, that is kidneys, lungs, prostate, other cells like macrophages. Half life to 10 hours. Okay, kidneys, renals are the major route of elimination. Okay, so that's what you go for dose adjustment in case of renal failure. Through 3. Okay, now you come to because elimination the nalic acid. So individual drugs, there is flow 4 quinolone derivative and affecting the bacteria positive organisms. So here మనకి మెయిన్ గా because of first generation లో వస్తుంది కాబట్టి ఇది నాలిక్ యాసిడ్. So they will have more side effects like urticaria. area. Okay, and GIT upset in the form of vomitings and diarrhea, fever, drug fever, so eosinophilia, so allergic phenomena, paralysis, myalgia, convulsion sometimes. So, yeah, okay, increase intracerebral, intracranial hemolytic anemia mention. So, and in the form of pseudotumor cerebri. So, like that, the side effects will be more with knowledge. So, now we come to this. So, bioavailability up to 70% of oral route of administration. And you see the off life 5 hours. 5 hours. So they're mainly renal as well as liver. It both takes place for clearance. Okay. So here uses like the infections with gonorrhea single dose, 250 milligrams of ciprofloxacin, single dose, and systemic gram-negative infections, 52 milligrams, 2 times per day. So here 250 750 war. Next, non in case of IV, so 200 to 400 milligrams BD. Non-fluoxacin. Non-fluoxacin. So here non-fluoxacin 50% after oral intensity of life is 4 hours. And in case of uses, unit times 2 times condition. Non-fluoxacin content of metronidazole and fixed dose combinations. Next one is ofloxacin. Ofloxacin shows higher bioavailability. Higher bioavailability, 95%, more than 95%. Half life 7 hours, 7 hours. So that three times per day, like that, 2 times per day. So uses various gram-negative infections. There's gram-negative infections. So that is 200 to 400 milligrams once per day. So and bacilli, acid fast bacilli and తెలుసు acid fast bacilli, that is tuberculosis. Next one is sparfloxacin. Okay, so under sparfloxacin, so this also so higher bioavailability oral, so after oral administration. Half life is very long, that is 20 hours. 20 hours clearance, renal I mean gas problem. So dose is 200 400 milligrams per day in doses. So indications are renal problem, infection, also tuberculosis. Next one is pefloxacin. What is pefloxacin? So same, almost 90% of the availability. Half life is 12 hours. So mainly hepatic clearance. Dose 400 milligrams, 2 times per day. All gram negative infections. Okay. Lomifloxacin availability. Almost same. So bioavailability, bio 90%, 90%, and half-life 8 hour bioavailability. See, hours. Mainly here, in contrast to previous two drugs, it's a renal clearance. Renal clearance. So just at this dose. So dose 400 milligrams per day. Okay. The fluoxetine. The 90 bioavailability 6 hours and the renal clearance. So clearance been re-established. Renal, okay, per day for 2 weeks. So renal clearance. So dose is 500 milligrams one of various infections. Next, you come to the adverse effects. Very very important of this group. Adverse. So adverse effects, if you see system by system. So GAT అంటే కామన్ గా మనకి GAT upset. So if any drug is bitter taste or etc. So vomiting sensation also, GAT irritation also. acidity like condition, the patient may complain. So gastric irritation, it's like so it's common adverse effects. So and sometimes um, diarrhea like also. So next one CNS side effects. So hallucinations, uh, headache. So general complaint is headache, mild headache, and the hallucinations, so delirium like symptoms we will see, and seizures. Seizures occurs with simple use of various other agents like theophylline and other NSAIDs because of their drug interaction. Drug interaction. Theophylline is xanthine alkaloids, whereas NSAID is that is non-steroidal anti-inflammatory drug. So combination. So better to avoid these agents to use simultaneously. Next, tendon cartilage damage. So this is important regarding these fluoroquinolones. Tendon and cartilage damage. So here tendinitis, rupture of shoulder as well as the hand and Achilles tendons may occur due to cartilage damage in weight-bearing joints. So long-term administration of these fluoroquinolones leads to tendon rupture. Tendon rupture. So that's what they may be contraindicated in children as well as during pregnancy. Okay. So allergy is common to so many drugs like that. Here also photosensitivity, leukopenia, and eosinophilia like things you'll see. And one more thing is CBS. So ECG changes will observe longer QT interval with newer fluoroquinolones, that is moxifloxacin, cortifloxacin. So so that these are some sort of adverse effects, mainly adverse effects. So chasing manaki tendon damage is important thing you should remember with the fluoroquinolones. Long-term administration of fluoroquinolones of these they cause weakness of the tendon. That means tendinitis. So Achilles tendons weakness, so rupture of tendon also may happen. So cartilage damage. Okay, next one. So contraindications are in children because of uh, contraindications. Growing age, so they become susceptible. Cartilage tendons may be very, so they may feet interval prolongation, arrhythmias. So that's what you should be careful. Next one, drug interaction important. So quinolone metabolism of and that's why patient may get due to xanthine alkaloids as well as quinolones displace GABA. ఎవరు చెప్తారు నంబర్ 39 39 ఉన్నాడా జిష్ణు 39 number 39 number 39
Yes, sir.
number 39 number 39
Yes, sir. Hello. Yes, sir.
ఇక్కడ డిస్ప్లే అవుతుంది your number is displaying here
Yes, sir.
Snow.
Hello, sir. Hello.
చెప్పు ఓకే ఓకే ఏమి రెస్పాన్స్ అట్లేదు అక్కడ ఈ నెట్ ప్రాబ్లం ఉందా ఇస్తుంది నెట్ ప్రాబ్లం నో ప్రాబ్లం ఓకే రైట్ గుడ్ సో గాబా గురించి ఒక్కసారి చెప్పమ్మా వాట్ ఈస్ గాబా వాట్ ఈస్ ఇట్స్ ఇంపార్టెన్స్ దట్ కమ్స్ అండర్ గాబా ఈస్ న్యూరో ట్రాన్స్మిటర్ అవునా
Yes, sir. Yes, sir.
సో కమ్స్ అండర్ ఇన్హిబిటరీ న్యూరోట్రాన్స్మిటర్ inhibitory neurotransmitter. So,
Yes.
so whenever the quinolones inhibit they displace GABA, so that imbalance between excited and other drugs and inhibit neurotransmitter takes place. So that's what CNS actions. ఇందాక మనం చెప్పుకున్నాం CNS CNS side effects seizures like or delirium, so dementia like so mania like so that's what. So anxiety reactions is there. Seizures also because of imbalance between excitatory and inhibitory neurotransmitters. Reason may be different. It may be due secondary to drugs or drug interactions or blocking of the inhibit neurotransmitters. GABA from which they ఇక్కడ quinolones, so they displace the receptors. So that's what uh, okay. And here, so that's drug interactions like that. So mainly drug interactions. Here you will see minimal drug interactions. Now we come to this the side effect: renal toxicity, cardiac toxicity, hepatotoxicity. We come to the advantages: daily or dosing. So oral absorption will be more. So that's what. And the tissue penetration distribution will be more, and prolonged half life. So 8 hours, nearly 8 hours. So and the entry into the phagocytic cells, more efficacy. So more efficacy. So these are the more mainly advantages of these fluoroquinolones. Okay. Now we come to the therapeutic uses. Therapeutic uses. Okay. So what are therapeutic uses? Generally, what are the indications of course? In which conditions you can indicate these? So UTI. So norfloxacin. In case of urinary tract infections, norfloxacin more effective than aldrich acid and trimethoprim sulfamethoxazole. ఎంత చెప్పుకున్నాము రేట్ limiting step లో సల్ఫోనమైడ్స్ సల్ఫాటక్స్ లో ట్రైమెథాపిన్ సల్ఫామెథాక్సల్ combination they act at two-step level. So sulfonamide group of drugs lo, so that is sequential block. It's called a sequential blockade. So trimethoprim act at in folic acid synthesis. Next one, prostate infection. So prostatitis. So norfloxacin and STDs, various types of STDs. So single oral dose ciprofloxacin in the Neisseria infection, Neisseria gonorrhea. Okay. Next one, pelvic inflammatory diseases. So ofloxacin, single or plus clindamycin metronidazole combination, and chancride, ciprofloxacin dose. Now one dose 500 to 750 milligrams. Okay. So next one is GAT as well as abdominal infection. So in case of diarrhea, travelers diarrhea, ciprofloxacin 200 milligrams. In case of ciprofloxacin 500 milligrams. Okay, Shigella. So that is norfloxacin, ciprofloxacin. So standard dosage for 5 days. In cholera, norfloxacin. So in case of
Okay,
electric
is it
fever,
clear now?
typhoid. So ciprofloxacin, in case of ofloxacin, go for 500 milligrams per kg.
Okay. As
Hello? Yes.
industrialization is increasing day by day, what do we have? We have network.
Yes. Next one is respiratory tract infections. So in case of respiratory tract infections, in case of community acquired pure fluoroquinolones, cardiofloxacin, moxicillin you can use. So next one, effective infections with Haemophilus influenza, catarrhalis, moraxal pneumonia, chlamydia, moraxal viral infections, Legionella pneumonia, pneumophila, like that infections. We'll see. Next one is other indications: bone joint infections, bones and joint ciprofloxacin for 4 to 6 weeks, and anthrax. So ciprofloxacin for the prophylaxis. In case of anthrax, prophylaxis will be useful. Okay. So And the next one is ciprofloxacin indications of various fluoroquinolones. Okay, so here take home message will be, so what is mechanism fluoroquinolones, what are the various types of generations of fluoroquinolones, and their mode of mechanism action, and main side effects, what are the side effects, what are the various individual drugs, so more their mode of kinetic profile of elimination, renal elimination is also important. So some drugs eliminate through cells, some drugs eliminate through hepatic elimination. Okay, so and therapeutic uses of fluoroquinolones. So simple, prepare your so you should own okay. Just wait for a minute. ఒక వైట్ పేపర్ తీసుకున్నా అటెండెన్స్ కి వైట్ పేపర్ తీసుకున్నా అటెండెన్స్ తీసుకొని ఇస్తున్నారా లేదా వాళ్ళు తీసేసుకున్నా అక్కడ తీసుకున్నా ఇస్తున్నావా త్వరగా తీసుకున్నా టైం ఉందా మళ్ళీ 11:30కి ఒక వేరే క్లాస్ ఉంటుంది. ఎస్, ప్లీజ్ గివ్ యువర్ అటెండెన్స్. Number 1, 2,
2 present, sir.
3. Number
3
3,
present, sir. 3 present, sir.
63.
4 present, sir.
వినిపిస్తుందా లేదా మీకు? హలో, ఏమా ఎవరు? 1? ఓకే, yes, tell, give your attendance again. Number 1, 1 number 1 absent. 2
Roll number 2
Number
present,
2.
sir.
3 roll number 3.
Roll number 3
Please
present, sir.
carry on. 3
Present,
4
sir.
4 present, sir.
5 చెప్పు. 5
6 present, sir. Roll number 6 present, sir.
5 absent. 6 present. 7
7 present, sir.
7 8
8 present, sir.
9
5 present, sir.
9 absent.
9 present,
10
sir.
present, sir.
Number 10
10 present, sir.
9 present.
Yes, sir.
అలర్ట్ గా ఉండండి అమ్మా అందరూ. అలర్ట్ గా ఉండండి, టైం అవుతుంది కదా. నెంబర్ 10 వచ్చాడు.
10 present, sir.
10 absent.
11
10
present.
present, sir.
11
10 present, sir.
11
11 present,
Okay,
sir.
okay. 11 అమ్మా. 11 వచ్చాడా? 12
12 present, sir.
Number 12.
12 present, sir.
12 వచ్చాడా నందిని? ఓకే.
Yes, sir.
13. 13.
13 present, sir.
13 present. Okay, Neeraj. So 14.
Present, sir.
14 present. Okay, Saujanya. Okay, 15.
15 present, sir.
15.
15 present, sir.
Okay, 16.
16 present,
okay.
sir.
16. 16.
16 present, sir.
17.
17 present, sir.
అయిపోయిందమ్మా 17. Okay,
17 present.
18.
18 present, sir. 18 present, sir. 18
19
present, sir.
present, sir.
19.
19 present, sir.
19.
19
20.
present, sir. 20 present, sir.
ఎన్నిసార్లు చెప్తారమ్మా ఓవర్లాప్ చేస్తున్నారు అటెండెన్స్? 21.
21 present, sir.
21.
21 present, sir.
22.
22 present, sir.
ఓకే అయిపోయిందమ్మా 22 అడిగాను కదా ఇప్పుడు నేను 22. 22.
22 present, sir.
23.
22 present, sir.
24 present, sir.
22 అయిపోయిందమ్మా 23 కదా అడిగింది నేను 23 ఆప్షన్
23 present, sir.
24.
24 present, sir.
ఓకే 25.
25 present, sir.
25.
25 present, sir. 26 present, sir.
ఓకేనమ్మా అయిపోయింది 26. 27.
26 present, sir.
27 present, sir.
28
27
present, sir.
చెప్పండి 28.
27 present, sir.
29. ఓకే 29. 29. 30. 30
present, sir.
ఆప్షన్
30 present, sir.
30. ఓకే సంకీర్తన ఓకే 31.
31 present, sir.
32.
32 present, sir.
33.
33 present, sir.
34.
34 present, sir.
35. 35. 36.
36 present, sir. 36
37.
present, sir.
Okay, 37. 37.
35 present, sir.
37 అడుగుతున్నాను నేను ఇప్పుడు 37. 37 present ఆప్షన్ ఓకే ఓకే రైట్ 38.
35 present, sir.
38. ఓకే ఓకే తర్వాత చెప్పండి మీరు నెంబర్ అయిపోయిన తర్వాత ఆబ్సెంటీస్ ఎవరు మళ్ళీ ఓకే అగైన్ ఐ విల్ ఆస్క్ 38. 38 ఆబ్సెంట్ 38 ఆబ్సెంట్ 39.
39 present, sir.
39. 40.
39 present, sir.
40 present,
Okay,
sir.
40. 41.
40 present, sir.
Okay, okay. 41. Next, 41. 42.
42 present, sir.
42. 43.
42 present, sir.
43 present.
Oh,
43 present,
okay.
sir.
44.
44 present, sir.
45. 45.
45 present, sir.
46.
46 present, sir.
47.
47 present, sir.
48. 48. 49. 49.
49 present, sir.
ఎవరు 48
49 present, sir.
ఓకే 50.
50 present,
50. 51.
50 present, sir.
51 present, sir. 51 present, sir.
52
Okay,
present,
okay, okay. 53.
50 present, sir.
53. 54.
54 present, sir.
55.
55 present, sir.
56. 56. 56. 56. 56.